pedaling on this way. Try to maintain the same power. You are going on 175 watts, so try to be accurate in 90 pedals per minute, so try to maintain it. Don't look so much to the screen to not to twist. You have to do it, but try to keep on stride. And the first thing that I will like to show you is how it's affected the body position related with the electromyography. We are going to check 3 different positions. We are going to check 3 laps here, and then we are going to see how it's affected the distribution of the muscles depending on this. This bicycle has got 3 different positions, basic position. One is the aero position, the other one is this other one, and the third one is like an uphill position that is put it on the hands here. When the body and the center of the mass of the cyclist, on this case, is moving forward and backward, the way of pedaling changes a lot normally. He's in a medium intensity, but the use of the quadriceps and the use of the ischios is going to change, only changing 3 positions on the handlebar. I am going to see and show you the comparison. So we have checked this like the Vaseline position, for example. Then we are going to check the second position. Wait a second to put it on one. Can you help me with the laps? Make a lap. Yeah. And put it on hands on the elbow pads. Yeah, it's okay. Okay. We'll record this and see if it is difference between this position and this other one. I will try to explain if this position is better than the other one, what are the characteristics of this position and the other one. It's not necessary to take a very long, laps. Maybe in 30 seconds, 1 minute, the motor pattern, if he's trying it, is enough to demonstrate what's going on. So we can, another lap now. Sammy. Another lap, and now the aero position. With this software, looking for this is quite difficult to understand nothing, because the data are very changeable. Here also, there is too much data to see at the same time. Maybe you can see here a very big mistake, but it's difficult to see difference between the other position at this with this kind of screen. So I think that you can stop, end the recording, please. Okay, the recording is stopped. You can position change or save as you want, and you can rest a little bit now. Take care. Okay, and let's see. We are going to analyze each lap, try to scroll in as much as possible the first part. For example, you go to the first part and try to scroll one side to be, that's okay. One part of the, I made the medium one. Yeah, and then, yeah, but no, shorter. The maximum scrolling possible to see here. Ah, that's okay, perfect. And can we scroll this either, more or less? No, it's okay, I think. So, as I said before, here, in each pedaling, yeah, make a little bit bigger, for example, in 100 or something like that. Yeah, that's all. So, the order of the contraction must be quite regular. It's not very regular because each contraction is not exactly same as the previous one, but the order must be quite well oriented. It's quite characteristic because you can see that this is the right and this is the left, maybe? Cannot see the...
This is left.
Left?
Left quad.
Okay. The left is a clear contraction with starting and ending. The right one is quite anarchy here. It's not doing a clear stroking on this compared with the other one. On the, this is the left, again. On the left hamstring, the contraction is quite straight and quite regular, and this other one several times has like this kind of things. On this case, and we are looking for a distribution, this is meaning this will be the medium of the scrolling, I suppose, will be? Is the medium value? Yes. Okay. So he's using the quadriceps a little bit more than the ischios on this position. Maybe he's using the right ischium, the right hamstring, a little bit more than the other one, and this is quite similar one with the other. He has got a very slight asymmetry because of the kind of contraction that is not clear on the right one. And this is because he's a little bit twisted over the saddle. And you know that you were twisted over the saddle? You didn't know before? No, any idea maybe?
Maybe, yes.
Maybe, yeah. He's folded to the left, means that more mass is on the left of the body. Put it on over the bicycle. No, you don't need to pedal now. Only put it on this position. Yeah, perfect. This is the hip, and the hip is not symmetrically over the saddle on this case. He's a little bit twisted to this side. It means that this contraction, this extension, will be more powerful than this other one because it's more triathlete on the left than on the right. As let's imagine, we don't know, but let's imagine that the both legs measure exactly the same. As is more triathlete on this side than on the other one, this ischium, the hamstring on the right, is going to pull from the pedals in a different way compared with the other one. Because when, as we have seen today morning, what happens is that the position of the pelvic over the saddle makes the ability of pulling or not pulling from the pedals, the automatic pedals. For those that doesn't know about the cycling, he's attached to the pedals. He cannot take out the foot without pulling from the pedal. So it means that it is folded to this side. He's pulling from the right side. Slightly, but that's the asymmetry coming from. So on this case, it's a quite clear case of symmetry, and he needs a new balance over the saddle. Maybe it's change of the saddle. Maybe it can be a reteach about how you sit over this saddle. Or maybe it's a physiotherapist treatment because you got some overload on your back, for example, that takes you to sit in a not very symmetric way. There are several reasons of one could be or could not be asymmetric. What happened with this with asymmetry? Happens more or less, it's problematic because happens one phenomenon that we have seen today morning with one of the cases. In this case, when the hip is not aligned in perpendicular with the bicycle, one of the knees is going inside and the other remains straight. When the knee is coming inside, it's dangerous because you make a valgus and the knee cannot bend inside. So one of the common pains in the cycling, that is the pain of the knee, that comes for not making a flex extension in a right position. I think that you have present some data about this, and the physiotherapist also has talked. That is the common problem of making this, can come because the hip is twisted. And he knows, he suspects that somebody is asymmetric, but he's not able for seeing that the hip is not over the saddle perpendicularly to the bicycle. And this, maybe you are not injured, but maybe someday the knee starts making pain, and you cannot know. And you put it on the saddle, upper, lower, down, and you don't know where the problem is coming from. And the problem is coming from the hip. So only making a 3 minutes pedaling is possible to say, and it's possible to try to explain to the triathlete, as you have understand right now, that your muscles are not working like two symmetric musicians. One is playing one music and the other one is playing another music. This on the basic or the baseline position. We are going to see the change between the one and the other. Yeah, questions?
Do you have any data for how even distributed the power or the load needs to be for when an athlete is perfectly symmetrical? Because I mean, there's going to be some variance even if an athlete is very symmetrical. So maybe it's not completely 50-50 between left and right. So what's the usual variance?
Normally should be. Normally should be. Talking about, for example, we are going to take off a little bit of the electromyography. We are going to talk about the strength of each leg measured in newtons on the right and on the left. If there is a anatomical symmetry on the legs, the professional riders that takes power meters that measures on the right and on the left, when everything works properly, they make you 49, 51 or 50, 50. That's very achievable. So it's nothing marvelous. A lot of them, when they are good or they are not very good, they can do this kind of data during races of 3 weeks. So it's not one day that they were concentrated, something like that. No, the symmetry is possible, and they pedal well. What happens, and it's not casualty, when something moves more than 2 or 3% on this symmetry, the problems income. Sometimes there is a diagnostic injury, sometimes it's discomfort, sensation that somebody is not working properly. I cannot push with my right leg like the left one, or I get pain in strains. Okay, yeah, it's not an injury, it's only pain, that I can support it, but it means that something is not working as should be. So we work with the limit of 1%. The baseline for us in the symmetry and DMG, what we teach on the courses today is minimum of 25, 25, 25, 25. It's a good starting situation. Not because it must be or meaning that everybody should do exactly the same job. No, it's not because of that. Because the optimum should be to work more with the quadriceps and less with the hamstring. This will be more gold standard. Okay? So we move on those range. What we cannot admit never is a clear asymmetry, more than the 2% of difference between right and left, or when the hamstrings works more than the quadriceps. That's not admissible from the point of view of the biomechanic organism of the movement, because we have seen in our experience and references that it's coming an injury in not a lot of time, if the injury is not already on the legs. So have I answered your question? Okay, so can we change the lap to see the second one, the more relaxed one, yeah, we take a scrolling of the second part, for example. Okay. Maximum? Okay. Here we can see that differences has become a little bit more. The expected symmetry here has become in something that lowering the left quadriceps is normal. He's taking more weight to the pedals, but there is not a way of taking exactly the same to the right, to the left, so the difference will go increasing, okay? That's one thing. And the second one, when these differences became bigger, what happens that the right hamstring, on this case, that is pulling from the pedals, became in a more powerful muscle. On those intensities in 3 minutes, it's impossible to understand, it's impossible to feel that difference, but the machine helped me on that. I cannot see what the EMG is telling to me, but it's quite interesting because of this. The tendons is exactly the same, but the movement of the weight of the body has made difference on the EMG. So the intensity, the cadence, and everything has been more or less the same, but he has changed only the position of the weight of the body related to the bottom bracket. That's the story. And can we see the third one? That probably will be interesting. Okay. Here we can see that a lot of things has been changing. Why? Because from the baseline position to this, the difference is not very big. So the amounts of kilograms that moves, they are not very big. But when you are going down to the aerobar, a lot of kilograms are coming to a new place, and there is a very big biomechanical difference between one position and the other one. There is a lot of kilograms. The fulcrum has moved around 70 centimeters. With all of the mass, 70 centimeters is such a big difference. So on that case, what we can see that everything has changed and happens something that is quite interesting. The contraction of the quadriceps, instead of being organized, as we said, 1, 1, 1, 1, 1, 1, in scale, has become in a semi-continuous contraction that probably is going to be the starting of the hypertitania, means that the contraction is working every time. And this is quite complicated to sustain from the point of view of the resistance. You sustain, but not in a proper way from the point of view of the ergonomy. And opposite to that, the hamstrings have become more organized. Why? Because if I pull from the hamstrings, they have to organize themselves. If not, I cannot pedal. So the freedom that they have from some of the muscles makes some muscular noise, and this is the organization of those muscles. That probably seems, from the point of view of the motor pattern, that in this case you train much more on this position than in the other ones. I mean, from the whole time that you can be training, probably on this position you stay 70, 80% of the time, and between the other two positions, maybe it's not the 20% of the time. The most organization that we see on the muscles means that the motor pattern is more and better recorded on the brain. So what could we do with this? So probably we need to change several things on the bicycles to try to get in better. The situation, in this case, is better from the point of view of the relation between the quadriceps and the hamstrings, but the symmetry is very evident. So if this asymmetry doesn't come as should be, probably maybe the performance is going to be limited somehow, or maybe you can always be semi-injured, overcharged several muscles that work much more than the other ones. And that cannot be on the bicycle. The bicycle is symmetric. My muscular job must be symmetric too. There is no way of finding another solution to this. So on this case, the relation anterior-posterior relation of the muscles is correct, but the right-left one is not correct. I think that we could, from those data, can you repeat, for example, this for me? We are going to make one. Okay, stand up for me. Stand for me. Sit now, yeah, on this, and pedal for me, please. A little bit more. Put it on this ischium, better on the saddle. No, a little bit more. Yeah. A little bit more. This one. To the right. Jump to the right. Yeah. Perfect. Yeah. Pedal for me, please. More or less on the aero bar with the same. We are going to record 30 seconds of this position on the aero bar to compare the one and the other. This is your more trained, the most trained position. So you put it on 170, 80 watts, 90 of currents. look forward. Okay, I think that, Sami, I think that we could stop the recording and see what's happened. Everything has changed. Now, the relation between front and back is properly good, and the symmetry is more achieved. The only thing that is not yet working properly is the right quadriceps, because you can see that the noise has gone on the first one, but the noise is not totally corrected on the right one. Why? Because the brain yet has not time to make automatization of the movement. So you need to train on the right position to become perfect. So there are several chains that they are acute. You can see that the tendency is correct, but you cannot ask for the brain for the first time that does one movement in one position in 30 seconds to improve everything in 30 seconds. Several times you need hours of practice for doing on the proper way. But you can see that moving a little bit the hip over the saddle position, you can achieve numbers that tells things that maybe can be difficult to understand if you don't see that. I can do exactly the same for you and say, can you feel that? And you say, yeah, I feel, but I don't have a very clear idea. If I show you the data, you have not to believe in me. Those are the data. You go to try into your mind tech, and when you come, I show you the data, and you say, you are symmetric. And I say, yeah, I am symmetric. Let's go. So this is one demonstration of one movement that can be made. And if we remain for instead 30 seconds, we stay for 4, 5, 6 minutes, probably the right quadriceps is going to make automatization of the movement much more better. So we learn a lot of movements by repeating them. So we are really accurate and successful when we repeat them a lot of time. But doesn't mean that repetition is useful. The good repetition is useful. The other one is not. So this is a very small example of what can be done with one cyclist, that a lot of customers comes to us and say, okay, put it on the saddle, put it on the handlebar, change the wheels, do whatever you want, but please make me more symmetric. And the only thing is to change the position of the body. That is not maybe as spectacular and as the other thing, but it's very important to understand, make understand to the customer that it's necessary to sit properly over the bicycle. No? There are several different things that can be done over this. This is one very good example that somebody wants to see something. Can imagine somebody one exercise to do here live, or you got any kind of, I got one, I don't know, pain over church, or one question on my head that has not answered yet. If somebody wants to see how we work, this is a minimum example, but it's very fast. And if you achieve the solution for the professional of doing this and you teach them that they have to go straight on the bicycle, the physiotherapist that is working on this with this machine works very fast, and he wins money doing that because he avoids the pain of the customers. Fast, easy. If not, everybody here knows about the electromyography a lot, probably more than me. And nobody knew how to move your own body to make equilibrium on your muscles. So that's the key of the story. Okay? Somebody wants to see something or make any experiment with our demo boy? Everything is clear, so.
Well,
professionalism and the overall understanding both on the EMG and also the knowledge about the discipline and the biomechanics related to this can combine really good results and quite fast actually also. So and there has to be I'm sure that there are things that you are able to dig deep into the cycling performance related to, for example, the efficiency and so on and so on. That might be a good example. Of course, we have a limited time here, so I would like to, of course, hear about more if somebody has more questions. But I think it was a really impressive demo here. So.
Yeah, there is one thing that is quite easy, and I think that it will be quite visible. He makes a lot of strength pulling from the handlebar, yes or not? You feel that you hold from the handlebar somehow?
I think yes.
Maybe no, yes. No. We are going to do is to change only the position of the hands. Everything is going to remain exactly the same. Instead of doing that, he's going to go with the hands relaxed on this. He's long distance rider. Wait a minute. He's long distance rider. I mean, he can move very small movements and have a lot of difference at the end of the day. So obviously in 1 kilometer, this is not going to work. But in a very long distances, small differences make big differences because of the time. And several times I suppose that you got pain or charge here, or you feel that these muscles, they are not working. I don't have here the EMG, but it's quite, as we work with triathletes too, we know more or less the common pains, where they are coming from. So could we expect that holding from here with some strong and not holding from here is going to make the difference here? I'm sure that it's going to make the difference. So you start holding from the handlebar, pedaling, yeah? Not super strong, but holding every time. And we record for 30 seconds. Okay, and now put it on a lap and relax your hands and put it on one against the other if you want, if you feel more comfortable, but not holding from here. Okay, I think that's enough. Good. And we are going to see the scrolling of this, maybe a slight difference between the one and the other. We can see here the difference obtained from one position to the other one. The prevalence also of this noise that is looking for stability on the right quadriceps, and he cannot achieve it, neither doing that. And now we are going to change to the second one. But we have to change maybe the measure of this. You have to select another range or something like that?
Yeah, it's the whole second part.
So we can see that only one movement of the position of the hands make the difference between the anterior-posterior relation, and also about this. Probably he's holding from the handlebar harder. You should need, you know, the handlebars that are bent upside, this position of the hands much more better than this other one, because the other one you are expecting for having stability and try to stabilize it yourself, but you cannot achieve it, so you are on the wrong way to the solution. But I think that if you are going on that way, it will be more stable and you can find the stability that you are looking for. But it seems like the tendency is quite clear. So what you do is to make more effort to try to find stability. And what you should do is don't to make any effort to try to find stability. At the end, we are talking in triathlon, long distance triathlon, we are talking about the principle of ergonomy, the minimum possible effort. So the less contraction that it is a good news always. So I think that can be something like that. And obviously, related to this, we have in the previous one, on this other one, you need to check your hip, because it's when you disconnect, it's twisted to this side. So you have to be, at least at the start, you need to be permanently concentrated on the position of the hip over the saddle. Maybe sometimes it's impossible to achieve stability with the saddle. Okay, so change the saddle. That's the solution. So, but maybe it's a good example, as you said, of minimal changes that, as I said, in 1 kilometer, this is not going to make the difference. There is probably no good difference, but in long distance, this minimum difference is 1%, 2%, is a lot of difference at the end of the day. We are talking about in one Ironman, this can be 1 minute, 1 minute and a half, 2 minutes, that it is time that try to save training is much more complicated than doing this kind of change. So I think that is a good advice.
Yeah.
Okay.
And we want Tuukka to succeed. He's one of the best long-distance triathletes in Finland, and we are supporting him. So it's a really important thing to listen carefully to. Yeah.
So, you know, support with a new saddle. So, something more? Any other kind of comparison that somebody wants to see? We will do a last one that I think that is very interesting. You have seen this. Today, in the triathlon, it's a very big speaking noise about the cadence. There are theories talking about the less possible cadence can be better because of, there are several reasons for achieving, or people of the maybe more old school that they try to maintain the 90, 95 or this kind. So we are going to try to maintain the same power with very different cadences. Around slow cadence must be 75. I have heard that several riders, they are achieving lower than 75 today, but 75 I think is okay. 75 and 95, for example, to compare what's the organization of the muscles, where is more organized or less organized the muscles from the point of view of the ergonomy. So we will do a very small recording. You can start on one on the other, as you prefer. Put it on the aero bar and try to, I will tell you, 770. Probably you can lower in the sprocket to the, okay. When we are stables, you put it on the lap to have exactly the same sample with one and with the other. Around 65, 70. A little bit more. Yeah, try to maintain the electrical activity. Yeah, or the power. You're looking for the power, though. Yeah, okay. You make a lap of, yeah, right now. We record for some seconds. Okay, you can stop and see the one and the other difference. And then we can check the last part of each one when everything is more or less stable. Before the lap. Okay, we can see clearly the organism of each signal and the used power. The amount of asymmetry is very high. So no asymmetry between front and back, right or left. And then scroll the second one with high cadence. That's before the for example. The asymmetry stays exactly on the same tendons, but is less symmetric than doing slower. So we have done to change the time, and the only thing that has moved your hip is the hip positioning. The other factors, not related with this, but the other factors has not changed. Not the cadence, that the cadence is a great factor to change everything. The tendons is exactly the same, because it's the movement that has not changed. Comparing the one with the other, seems that you are more trained on this than on the other one. You are not able to sustain for a long time very low cadences. It makes you a lot of effort. The question that probably we cannot solve is, and if I became very symmetry, could I go in a lower cadences? Well, it's on you. It depends. If you are going and decided to try to go more symmetric on the bicycle, what you could achieve is to try to go lower in the cadence. But today, if you read one journal and say, no, today what is good is to doing less than 80 pedals per minute, probably the symmetry is going to be higher. And then it can come the injury. Maybe it has not come with 90 pedals per minute, but it can come with 75. So several times when we do some changes on the training, we have to think that some factors that they are on our day-to-day work maybe can explode because this change on the training. So this is a very small example of what can happen if you decide arbitrarily to change the cadence, because what is going to happen is the asymmetry is going to make bigger. Injury, not, who knows. But the principal thing is to fix the asymmetry and become more symmetrical of the bicycle, because all the other changes, if not, they are going to be a little bit tricky. So that was a great example of how the cadence, that is something that can be changeable from one day to the other or one rider to the other, probably not spending a lot of time, you can achieve a good advice of, if it is good, if it's not good, in your case, to do the change or not to do the change. Several questions that you make to your own every week. I need to change something, it's good on this, should I go to one sport medicine center to fix where in my better currents, my perfect currents? So you can got this kind of answer that helping you in having a better choice. Okay, so I think that's everything, and we have shown the potential use of the machine, and for me what is really useful is the speed of the results that you can get. So you have not to wait for 3 months for seeing the change, if it's coming, it's not, how you feel better but not perfect. So doing small changes in a very small time, you can see if the tendons goes on the sense that you need or not. That's my experience with last year working with the EMG system. So if somebody wants to ask something, or if not, I suppose that people is going, taking care of the airplane and everything, so. Thank you.